care is care that you receive during your pregnancy. This is standard care that everyone receives, even if you are healthy and having a healthy pregnancy. Attending these appointments will ensure that you and your child remain healthy and have optimal supports. Antenatal care increases your likelihood of having a healthy birth, as well as improved bonding with your baby, and your baby having the best start to life possible. It's important to go to all the appointments and do all the required testing. Usually, for women who are classified as low risk, the journey you can see on the screen is what you can expect in a standard antenatal care journey. You would have your first GP visit once you have missed your period or once you've had a positive urine pregnancy test. You would do blood tests to confirm your pregnancy and check your health and organise your first dating ultrasound. You would discuss antenatal care options via a public hospital or private obstetrician, private midwife, or whether you're passionate about having a doula with you. For a woman with an uncomplicated first pregnancy, you should expect to have approximately 10 antenatal appointments. For uncomplicated pregnancies after that, you may expect to have around 7 appointments. Let's discuss your choices during antenatal care. You don't have to remember all of those. You can just get an overview from this video and discuss any specific questions you have with your clinicians. Firstly, let's talk about the public system journey versus the private system journey. The public system journey, if you choose to receive public health care, the hospital will decide, based on your health, whether you will see the midwife team or the obstetrics team. This will be free of charge if you have a Medicare card. If you are eligible and your hospital offers this service, you can also see a group of midwives in the midwifery group practice. This means that you will be seen by the same group of midwives throughout your pregnancy, and one of those midwives will be there at your birth. This will ensure that you will know who's going to support you through your birth. Also, based on your eligibility, you can consider doing shared care between a GP and the hospital. This may be more convenient for you than visiting a hospital for every visit throughout your pregnancy, and your GP can continue caring for you after you give birth. In the public system, you may see a different clinician every time you go to hospital. As for the private system journey, you should decide whether you will see a private midwife or a private obstetrician. If you're high risk, or if you need fertility support, you will likely see an obstetrician. The private system will require some out-of-pocket payments from you on top of the payments from your private health insurer. You should discuss these costs with your provider before deciding. Overall, the private system offers you more choice and more control over your journey and enables you to see the same clinician every time. It's worth noting that some private hospitals have a cutoff for preterm labour. So, if for example, in some hospitals, if you go into labour before 34 weeks, you may need to go to a public hospital even if you're registered at a private hospital. Some hospitals, both public and private, don't have neonatal ICUs, and so if your child is born and the doctors are concerned about them and require a neonatal ICU, they may require transfer to another hospital after delivery. If you're not covered by Medicare and have overseas or local health insurance, sometimes going through the private system may be cheaper for you overall. So it's worth investigating your financial options if you don't have Medicare. If you elect to go privately and are low risk, you can decide whether you want to see a private midwife or a private obstetrician. An obstetrician can offer you fertility support, IVF support, and perform elective cesareans. Private midwives may support you holistically, and usually patients report that midwives have more time for well-being and education. And midwives can also do home births. Studies show that patients who go through midwifery care are more likely to have unmedicated vaginal deliveries. If at any point you hit a hospital during a home birth, you and your midwife should immediately call an ambulance and go to hospital for your and your child's safety and well-being. You can also have a doula with you during birth. A doula is a non-medical person who supports you during labour. They will support you throughout pregnancy, before labour, during labour, they may attend your labour, and support you postpartum as well. Some women describe doulas helping them with things like massage and aromatherapy or cooking for them after birth. Please note that a doula is a private, non-clinical person and is not covered by Medicare or private health insurance. During first trimester, you also need to choose between the NIPT, the non-invasive prenatal testing, or first trimester screening, which happens at approximately 10 to 13 weeks. Both tests check for chromosomal abnormalities, such as Down syndrome, Patau syndrome, and others. The NIPT blood test is available from 10 weeks, is usually privately done, costs approximately $500, and can test for genetic abnormalities as well as the baby's gender. Many of my patients do it primarily to find out the baby's gender as early as possible. Alternatively, instead of the NIPT, you can choose to have the combined screening, a blood test and an ultrasound between 10 to 13 weeks, which only costs approximately, with most providers, $100 out of pocket. This also tests genetic abnormalities, but will not reveal the gender, so you'll need to wait until 22 weeks to find out the gender if that's what you want. You may need further specialized testing if either of these screening tests reveal any abnormalities. Your doctor will discuss this with you if that's your case. At 12 to 14 weeks, you will meet your specialist hospital team for the first visit. This will be exciting, especially if this is your first pregnancy. Every visit during your antenatal care journey will check your urine, blood pressure, baby's growth, the height of your uterus, this is called the fundal height, and many other things. At around 20 to 22 weeks, you may have a routine ultrasound to check the placenta, fluid around your baby, baby's features, and several other things. If you don't already know the gender, they can tell you the gender usually at this ultrasound. Now, let's discuss the oral glucose tolerance test. This is usually organized at around 24 to 28 weeks, and usually you would go fasting in the morning to the pathology department, not eating anything from dinner the night before. You will be given a sugary drink and have a series of blood tests. We should note that some women do not like the taste of the sugary drink, but most women love it and describe it tasting like a sweet lemonade on a hot day. So hopefully you enjoy drinking it. You will drink this and have a series of blood tests before, 1 hour after, and 2 hours after the drink to check how your body is metabolizing the sugar. This blood test will give us a clue about whether you have gestational diabetes. Your iron levels will also be checked at the start of pregnancy and usually again at roughly 26 weeks. If your iron is low, your clinician will discuss with you how you can manage this. Some women who have a negative blood group will require anti-D injections, which your doctor will tell you about. These are usually given at 28 and 34 weeks, depending on your local guidelines. There are some routine vaccinations that I wanted to discuss with you that are recommended during pregnancy. These include the annual influenza vaccine, the RSV vaccine, and the whooping cough vaccine. The RSV vaccine is a new and highly recommended vaccination to prevent serious disease and prevent your baby needing hospitalization or ICU. The mother is given the vaccination, which ensures that the baby is born with antibodies that protect the baby from RSV. So if the baby is exposed to RSV in the first 6 months of their lives, they may be able to overcome the disease or have less serious infection than they otherwise would have. In the third trimester, your visits will include advice about sleep, to prevent stillbirth, and the GBS swab. It's usually recommended to sleep on your side to prevent stillbirth, and it's important to try to not sleep on your back. Some women find that they benefit from pregnancy pillows to guide how to sleep. In Victoria, we usually perform a GBS swab for bacteria on the vagina that can cause infection for the newborn. This will be done in the third trimester, and your clinician will show you how to do this. One thing that I really enjoyed doing during pregnancy is creating my birth plan. It's important to attend labor and birth classes to prepare yourself physically and psychologically for this step. It's essential to attend those with your support person so that they can prepare psychologically as well. You should research active birth, research hypnobirthing, research pain relief options, and see what suits your style. Preparing will increase your chances of enjoying labor. The day I gave birth was one of the best days of my whole entire life. I felt so brave and powerful. The preparation helped me not fear the pain and embrace the thrilling power of that process. I used my breathing and my voice to express the pain, and I gave birth sitting up. At the end of your pregnancy, you will have a series of visits which will check your and your baby's well-being. You should discuss any questions you have about your birth plan, breastfeeding, sleep safety, and other things with your clinician. You may discuss induction of labour if your labour doesn't naturally begin. You will also discuss being aware of fetal movements and reaching out for medical support if you're concerned about reduced fetal movements. In all your visits, you should ask to involve an interpreter if required and bring a list of questions to discuss with your clinician. If you have any questions about your test results, interventions, cultural requirements, or anything at all, please feel free to voice those and ask as much as you want. Your comfort, psychological, and cultural safety during antenatal care is paramount. This should be a physically positive, mentally positive, intellectually positive, and psychologically positive experience for you and your family. You should always feel psychologically safe and culturally safe.